COVID numbers continue to trend downward after last month's spike. The state reported 17 virus-related deaths. Tomorrow is another day where the state will do a check of old death certificates. We added 2,100 cases today. Our daily case average down nearly 900 compared to last week. The positivity rate has fallen below 8% now. It stands at 7.96%. Governor Gretchen Whitmer gave another COVID update today.
She focused on the state's goal of reaching vaccination percentages high enough to get rid of restrictions. Political reporter Rick Albin here now to talk about an effort that could give another government agency authority to reimpose those restrictions. Rick.
Yeah, the latest in a brewing battle, another inter-branch squabble over the COVID response. Republicans crying foul about one regulatory agency's attempt to write rules that would leave it the authority to reimpose sanctions even after the governor's metrics would theoretically let them expire. I asked the co-chair of the agency overseeing such things about that on last week's To the Point and talked with the governor about it today. What do the rules say? For example, do they continue social distancing and mask wearing in businesses, right?
Yes, that's correct. Almost anything you see happening today or have seen happen in the past is written into permanently MIOSHA's rules going forward. I don't expect them to say, you know, every business forever after is ever going to wear a mask. But my big problem with that is that the department has that ability forever forward to decide that. And I think that completely cuts out the legislative process.
The promise of vaccines is that at some point we get, as you say, back to normal. And that would mean for many of us not only being able to get back to work fully, the remote aspect would be gone, but so would be wearing masks, for example, when we're in our workplaces. At the very same time that's the promise, MIOSHA is proposing rules that could keep those same policies available if they decided to use them, wearing masks and disinfection, that kind of thing. Why is it necessary for another agency to take on that responsibility when Health and Human Services has been handling it during this period of time?
Well, MIOSHA is focused on workplace safety. That is their role. They've been working very closely with DHHS and big employers as well as labor leaders. We want to make sure that we get this right. We're also anticipating some further clarification from OSHA, the federal agency. And these, I think, are important aspects to us re-engaging in the workplace and doing so in a sustainable way that is safe and doesn't contribute to spread. And that's the ultimate goal here.
The legislative committee with jurisdiction is called the Joint Committee on Administrative Rules, and they're holding hearings on those new rules. It's not impossible that the argument between the executive and legislative branch could end up in the third branch, the judicial.